treating food allergy. If I have a baby, introduce a formula and the baby reacts, then I have to come to you. What are you doing?
Well, first I diagnose, I confirm that this is an allergic reaction, and what kind of allergy is it? Is it Ig mediated or non-Ig mediated? And then once we confirm that, we are going to discuss management options. So we have an option of avoiding the milk completely and using hypoallergenic formulas, or we can talk about introducing baked milk in the baked products.
When are you introducing this baked milk? Anytime?
Well, when the child is, so baked means there's a baked product, so they have to be introduced to a cereal, or and should be able to eat it, so have the skills, the feeding skills. So realistically, it's not going to happen under 6 months of age, and usually happens, around 1 year or older.
And these baked milk products then are consumed and they are tolerated?
So we confirm that they can be tolerated, and in fact 80% of children with milk allergy do tolerate milk in the baked products. And we're talking about things like muffins, cookies, rolls, cakes, that are well baked. And then we tell the children how to add them to the diet at home. We recommend 1 to 3 servings per day, and they are well tolerated. The children are growing fine. Also helps the anxiety, around the foods, because if you don't know exactly what the status of tolerance is, then, parents have to avoid all kinds of processed foods and baked goods. And
when the child reacts at 6 or 7 months, then you stay away. You say stay away from this baked milk, but you will retry sometimes.
Well, so if we had a child who reacted, let's say at 6 months to baked milk, we would definitely follow up with the allergy testing, with the checking the immune parameters, the skin testing, the Ig testing, and then over time we would consider reintroducing it under supervision. So it would be a challenge. It is physician supervision. Well, we usually wait. It all depends. It depends on the test results, depends on the severity of the reaction. If you tell me that the kid ate it and had, a few hives or had, loose bowel movement, obviously I'm going to retry it more sooner than if I had a child who developed wheezing and, difficulty breathing, had anaphylactic reaction. Then if there is an anaphylactic reaction, I'll at least wait a minimum 2 years before retrying it. If there was a milder reaction, we can, retry it in 6 months or sooner or later.
And there's a certain percentage of children then who never tolerate cow's milk, right?
So this is true. We have that's a small subset, but
10, 20.
Well, 20% from our
20%.
studies. 20% of our from our studies reacted to the milk in the baked products. So the vast majority, do tolerate it in baked products.
So once I am not tolerating any cow's milk at 4 years, I have to give up. Is this correct?
That's not true. Totally untrue. I mean, it's like this old sort of dogma that everybody outgrows us by school age, right? Which is like, 5 to 7. And this is totally not true what we're seeing in our patients. Then, you can outgrow it when you're 16, when you're 18. The thing is that the higher your Ig levels to cow's milk, the later you outgrow the allergy. And if you have those, extreme cases, they may retain their milk allergy when they're adults. It's uncommon, but it's happening. And I think, the patients that we're seeing right now are a different sort of generation. It's a different type of allergy than 20 years ago.
Okay, but there's always hope.
There's always hope, and there'll be treatment. We can always treat them with, immunotherapy, for instance.
Okay. Thank you very much.
All right, thank you.